with these things in mind that HCT and CAR-T recipients have poor outcomes after developing COVID-19. Secondly, they do not respond to SARS-CoV-2 vaccinations either. And thirdly, the knowledge that we have gathered from general population that waning immunity may be counteracted through additional vaccine doses. We designed this study to examine if a third vaccine dose improves seroconversion rates among this subgroup of immunocompromised patients. We designed this study with predefined inclusion and exclusion criteria and examined serological responses to third messenger RNA vaccine dose, primarily BNT162b2 and mRNA 1273. One of the key inclusion criteria was that only those patients were included who were not seroconverted after completing the 2-dose primary vaccination series, which means they had no antibodies according to the assay cutoff. Some of the other inclusions included, the things that included strict intervals between second and third dose, as well as between third dose and humoral response assessment. We excluded those patients who had their antibodies checked too early after the third dose, primarily due to delayed immune reconstitution in this patient cohort, and also those patients who had a prior history of COVID-19 infection anytime prior to receiving the third dose. Antibodies were assessed consistently at all time points using the same validated assay that detected IgG directed against the receptor binding domain of the S1 subunit of the spike protein.